I would like to invite Devika from Gandhi Medical College. This is your PPT only?
No. A very good morning to one and all. I am Devika from Gandhi Medical College. I am third year student. I am here to present the paper titled Knowledge, Attitude and Practices of Contraception among women attending antenatal, postnatal and family planning units in Gandhi Hospital. My guide is Dr. V. Suhasini Madam, Assistant Professor of Department of Community Medicine. Introduction. India is the second most populous country in the world with a population of over 1.24 billion and the total fertility rate is about 2.51 births per woman. And this uncontrolled population explosion hinders the growth and development of our nation. So, there's a need to stabilize population. The aim of this study is to determine the levels of awareness and practices of contraception among women attending Gandhi Hospital. Objectives are to study the socio-demographic profile and to study the knowledge, attitude and practices of contraception and their relationship to the socio-demographic profile and to study the misconceptions regarding contraceptive usage. Methodology. This is a cross-sectional study conducted between April and August 2014. 175 married women attending antenatal, postnatal and family planning units in Gandhi Hospital were interviewed using a pre-tested questionnaire and the results, data was analyzed using Microsoft Excel and chi-square test. Rationale. Despite constant efforts by the Indian government, the unmet needs for contraception still remains. And the reasons for this must be studied so as to formulate suitable programs, and hence the study has been taken up. The results and analysis. Socio-demographic profile, about 3/4 of the study population were residing in, they were about 21 years of age, and 4/5 of them were residing in urban areas. The mean age of marriage of women under study was 19 years and the mean age of the mother at the birth of her first child was 21 years. Only 27% of the women were aware of spacing methods, while only 13% have used any of them. And of them, 3/4 were self-motivated and the rest were motivated by doctors. 3 women conceived while using contraception due to irregular usage. This is a bar diagram representing the awareness and practice of various methods of contraception except tubectomy. The highest rates of awareness were OC pills and IUCDs, followed by condoms, and IUCD was the most commonly used method of spacing method of contraception. This is the awareness among various groups and the practice. The source of knowledge, about roughly 40% of them have obtained from doctors and another 40% from media. Male contraception, the awareness was only 10%, while the practice was just 4%. Attitude towards contraception. The study population had a negative attitude towards temporary methods of contraception, and roughly 4/5 of the population had positive attitude only towards permanent methods, while about 7% have followed none of the methods. 10 women under the study population have underwent medical termination of pregnancy due to unplanned pregnancy, and the method of contraception most commonly used after MTP was tubectomy. The reasons for not using spacing methods, because they were not aware, not willing to use, and some of them have thought it was not required. Others have faced family opposition. The common misconceptions regarding contraceptive usage are the unknown side effects and inability to conceive at a later date. The others include infections, back pain, etc. Relationship between socio-demographic profile and the knowledge, attitude and practices of contraception. With respect to age, women above the age of 21 years had a significantly higher rates of practice of contraception. residents did not have much effect on the awareness or practice of contraception. There was not much difference between urban and rural areas. Education, women attending college had a significantly higher awareness of spacing methods of contraception. Occupation was by far the most significant determinant in knowledge, attitude and practices towards contraception. Working women had higher awareness, positive attitude towards spacing methods and practice of spacing methods when compared to housewives, and this is a highly significant finding of this study. With respect to income, the higher income groups were more likely to practice contraception. Age at marriage did not have much effect. Discussion. Most of the women interviewed had knowledge of tubectomy and only 27% had knowledge of spacing methods. And this was similar to the study conducted by Sunita et al., where all the women knew at least one method of contraception. The knowledge of other methods is as follows, with the highest being for occipals and IUCDs. And only about 13% of the study population had practiced a spacing method of contraception, and IUCD was the most commonly used spacing method of contraception. This is again similar to the results obtained by Dr. Sunita et al. Only 1.7% of the women were aware of emergency contraception, and this is similar to the study conducted by KMU et al., where the awareness of emergency contraception was as low as 1.5%. Tubectomy was the most preferred method of contraception, and this is slightly different from the results obtained by Basin et al., where condoms were the most widely used method of contraception. Women whose age was more than 21 years had significantly higher usage of contraception. Working women had significantly higher awareness, positive attitude and practice of contraception. The most common misconceptions regarding contraceptive usage are their adverse effects and inability to conceive at a later date, and the awareness and practice of male contraception was very poor, and none have practiced vasectomy. This is to illustrate the gross difference between the awareness and practice of spacing methods of contraception among working women and housewives. In conclusion, the knowledge of temporary methods of contraception are very low, and there is an immediate need to improve the knowledge of contraceptive methods. Most of the women had negative attitude towards temporary method of contraception. Women above the age of 21 years, higher income groups and working women had positive attitude and practice of spacing methods of contraception. The awareness and practice of male contraception, especially vasectomy, has to be improved. Small changes in childbearing trends today have huge implications for the future population size. These are my references, and thank you one and all for a patient listening.
Devika, it's a good presentation, it's a prospective study, but definitely we know that there is lack of awareness is one of the important things because we are not going ahead with this temporary methods, and we should change the medical when they come to the most important period is the antenatal period when they come. Yes. So that is a period where, from our point of view, there is regarding the advertisements and all those things, paper, these are all different, but from our point also we have to do so many things to improve this temporary methods. And nowadays the main this thing is the cafeteria approach, that the patient, yes, that means they should know what are all the temporary methods available, and we should give a choice for them to take one this thing and then follow with the same method. Then definitely we should improve these temporary methods, and then spacing between the pregnancies. That is our this thing. It's a challenge to the medical profession, and then we have to go ahead with that. That is most important.
Yes.
Good, you have chosen a title, which is related with population explosion. But can you tell the methodology how you have collected information?
I have interviewed the women attending antenatal, postnatal and family planning units, ma'am, by using a pre-tested questionnaire, ma'am.
So antenatal OPD, how you have collected information? How many months is required to collect information?
I'm sorry,
how many months are required to collect the information from? What is the inclusion criteria in antenatal OPD? Postnatal ward, is it in ward?
Ward only, ma'am.
One is in the OP and the other one is in the ward. And what about the third one?
Family planning also in the wards, ma'am.
Family planning, OP?
In the wards, ma'am.
Ward. Don't you think that is a biased information when A woman has come for antenatal checkup, okay, you'll be inquiring about that. Postnatal, anyhow, immediately after delivery, they are at a higher risk of becoming who are admitted in the ward. Is it not a biased information from them? Because the information, whatever being there in that individual, is maybe due to hospital imposed. They are there in the family planning ward. How will you compare that information with antenatal and postnatal women?
Yes.
Is it not a biased information? Then when you are clubbing the information from unbiased data to biased data, the entire results will change.
Yes, ma'am.
Is it not? And the other one is age-wise distribution. When the significantly higher levels among 21 years, you should have taken a little more. The cutoff should be somewhere around 30 years and above that. 21 years, what is the age at marriage in India? A legal age at marriage?
Now it has been raised to 21 years, ma'am.
Who will have that knowledge related to that? Obviously,
Yes, ma'am.
not at married, knowledge is
Yes, ma'am. I mean, in the study population, the percentage of women married below the age of 18 years was like
cutoff level, which is more than that. 25
Yes,
years. And if you see the population trends in India, most of the women childbearing age is up to 25 years age. The whatever contraceptive methods we are advising, they are focused at that age group. So
Yes,
if you are
ma'am.
taken a little more higher age, that will be a good thing. But
Yes,
otherwise,
ma'am.
very good study.
Thank you.
Anyone?
Okay, thank you.